Imagine waking up reasonably rested, climbing a single flight of stairs and feeling a kind of tired that doesn't fit the effort. You push through, blame stress, age, or the season, and move on. Here's the uncomfortable truth. What feels like normal fatigue can sometimes be your thyroid whispering long before anything obvious shows in the mirror. When the thyroid slows, your body's idle speed dips. Energy, skin, hair, mood, digestion, cycles, and even heart rhythm may drift, subtly at first, until the pattern becomes hard to ignore. According to the American Thyroid Association, these early changes are nonspecific and easy to miss, and a straightforward blood test is usually how suspicion becomes clarity. Everything here is explained in simple language and grounded in research from endocrine societies and major medical organizations. This video is educational and not medical advice. Use it to have a better conversation with your clinician. Let's start with number 7. Persistent fatigue after small efforts, even when you sleep 7 to 8 hours. This looks like energy that collapses after everyday tasks, a heavier feeling in your legs on stairs, or recovery that takes longer than it used to. Why it matters. Thyroid hormones help cells turn fuel into energy. When levels are low, your metabolic idle slows, and fatigue can feel out of proportion to your actual day. Large clinical overviews from major clinics consistently list fatigue among the earliest, most common features when the thyroid underperforms. What to notice? The timeline of your dips, morning versus afternoon, the duration of the slump, and whether a short rest truly restores you or you just power through. A common mistake is saying, "I'm out of shape," and trying to fix it with more intensity. If that backfires, more push but same crash, log it. Another mistake is blaming poor sleep alone. Yes, sleep matters, but if fatigue clusters with other clues below, it's worth testing. Number 6, feeling unusually cold when others are comfortable, often paired with dry, itchy, or rough skin. You pull on a sweater in rooms where everyone else is fine. Your hands and feet run colder, and your skin needs more moisturizer than before. Why it matters? Lower thyroid activity reduces heat production and slows skin cell turnover, so cold sensitivity and dryness tend to hitchhike together. Many patients notice cracked heels, scaly shins, or a flakier scalp that doesn't fully respond to lotion or shampoo changes. Track how often you say, "Is it chilly in here?" and whether this persists across seasons. A frequent error is blaming office air conditioning in July and winter drafts in January, then missing the pattern that never really goes away. If dryness spreads despite adequate hydration and gentle skincare, add it to your log. Number 5, stubborn weight change, either a slow gain or a plateau that resists your usual strategy. This is not the dramatic weight swings seen on TV. It's the familiar story, similar meals and movement, yet 2 to 5 pounds creep on, or the scale refuses to budge with methods that used to work. Why it matters? Thyroid hormones influence how you burn and store energy and how much water you retain. Small shifts add up. Clinical resources from national institutes note that hypothyroidism can be linked with modest weight gain. Conversely, an overactive thyroid may cause unintentional loss. What to do? Track weekly averages rather than daily swings. Note sodium intake. Water retention exaggerates short-term changes. And write down your true routine. An easy mistake is doubling down on crash diets, which often worsen fatigue, reduce muscle, and mask the underlying issue. Another mistake is ignoring strength training. Muscle is metabolically active and protective when metabolism runs slower. Number 4, diffuse hair thinning, including, in some people, fading of the outer third of the eyebrows. You notice more strands in the brush or shower drain and a uniform, less dense look rather than patchy bald spots. Why it matters? Thyroid changes can disturb the hair growth cycle, causing more follicles to shift into a resting shedding phase. Hair density may gradually decline across the scalp. Eyebrows, especially the tails, can look lighter or sparser. Patient groups and endocrine references point out that both low and high thyroid states can affect hair, and recovery, after correct treatment, often lags by several months because hair grows slowly. What to observe? Photos under the same lighting every 4 to 6 weeks, the part line width, and eyebrow edges. Common pitfalls: jumping straight to high-dose hair supplements without screening for thyroid or iron/B12 status, and taking large doses of biotin that can interfere with certain lab tests. If you do take biotin or hair, skin, and nails formulas, tell your clinician before blood work. Labs can plan accordingly. Number 3. Brain fog, slower thinking and mood shifts, sometimes a low mood, sometimes an anxious edge. This can look like word-finding hiccups, slower recall for names or appointments, difficulty sustaining focus, or a heavier emotional tone that doesn't match your life stress. Why it matters? Thyroid hormones influence neurotransmitter systems and the pace of metabolic activity in the brain. Hypothyroidism is associated with slowed processing and depressive symptoms. Hyperthyroidism can lean toward restlessness and anxiety. The key here is pattern and clustering. A foggy head that arrives with cold sensitivity and dry skin is different from a rough week at work. Track when the fog hits, sleep the night before, caffeine use, and any medication changes. A frequent error is assuming these shifts are just age or just stress, especially if they appeared over months rather than days. Another is stopping antidepressants or anxiety meds suddenly when thyroid is suspected. Medication changes should be coordinated with your clinician. Number 2. Bowel habit shifts. Constipation on the slower side, looser and more frequent stools on the faster side. In hypothyroidism, digestive motility can slow, making stools less frequent or harder to pass without an obvious change in diet. In hyperthyroidism, everything speeds up, including the gut. National health agencies emphasize these patterns in educational materials. What to track? Frequency, stool form using a simple Bristol chart, hydration, and fiber intake. Note whether constipation pairs with fatigue, cold sensitivity, and dry skin. Groups of signs are more informative than one symptom on an island. Common mistakes: endlessly escalating fiber without checking thyroid and hydration, or overusing laxatives that create a new problem. Another angle not to miss: autoimmunity often travels in packs. If you have autoimmune conditions like celiac disease, vitiligo, or type 1 diabetes, thyroid screening belongs on your radar because risks can cluster. Number 1. Menstrual irregularity and fertility signals. And for those who don't menstruate, an unexplained shift in resting heart rate or new palpitations. In people who menstruate, low thyroid levels can lead to heavier or more widely spaced cycles, increased cramps, or difficulty conceiving. Thyroid hormones interact with the reproductive axis, and the thyroid can influence ovulation. In others, especially with hyperthyroidism, a rising resting heart rate or a fluttering, racing sensation can be an early sign. Health agencies and endocrine guidelines discuss both ends of the spectrum: heavy or irregular periods and fertility challenges with hypothyroidism, and faster heart rhythms with hyperthyroidism. What to monitor: cycle timing, flow changes, intercycle spotting, and symptom diaries. For non-menstruating viewers, log morning resting pulse under the same conditions daily. Common mistakes include chalking cycles up to just hormones without checking thyroid, or dismissing palpitations as just anxiety. For those pregnant or recently postpartum, know that the immune system shifts around pregnancy can unmask thyroid issues. If you have persistent fatigue and mood or heart rate changes after delivery, ask about postpartum thyroiditis. And for adults over 60, particularly men who rarely think thyroid, new palpitations warrant evaluation because hyperthyroidism can increase the risk of rhythm issues in this age group. So how do you turn clues into a safe plan without guessing? Start with a 14-day snapshot. Write down energy dips with time and duration, moments you felt colder than others, changes in skin or hair, bowel patterns, cycle details if applicable, and a morning resting heart rate trend for non-menstruating viewers. Use 2 same light photos for hair and brows. List your medications and supplements, especially high-dose biotin, iodine drops or seaweed products, amiodarone, lithium, glucocorticoids, or certain cancer and immune therapies. Several of these can affect thyroid function or testing. Add family history of thyroid disease or autoimmunity. This compact log turns vague complaints into data your clinician can assess quickly. Next, talk labs. Not in a vacuum, but guided by your log and medical history. According to the American Thyroid Association and national health agencies, a TSH is usually the best first test to screen thyroid function. If TSH is out of range, a reflex-free T4 helps define whether the thyroid is truly underactive or overactive. In contexts where autoimmunity is suspected, like a family history of thyroid disease, type 1 diabetes, or other autoimmune conditions, your clinician may consider thyroid peroxidase antibodies to help identify Hashimoto's thyroiditis. For symptoms on the faster side, palpitations, heat intolerance, weight loss, your clinician may add tests to look for hyperthyroidism, and in select cases, thyroid-stimulating immunoglobulins when Graves' disease is suspected. Many symptoms overlap with lookalikes, so a smart workup also considers iron studies, vitamin B12 and vitamin D status, anemia, sleep apnea screening, depression and anxiety assessments, and medication side effects. This is not about ordering every lab, but about asking the right questions first and choosing tests that fit the picture. A practical prep tip most people never hear: biotin can interfere with certain lab assay methods, including some thyroid, cardiac, and hormone tests. Safety communications from regulators and large health systems encourage patients to disclose biotin and, when appropriate, pause high-dose supplements before testing under clinician guidance. Another tip: if your clinician wants morning labs, keep timing consistent for follow-ups. Changes in sleep, acute illness, or major stress can nudge results, so note those variables. Avoid large iodine swings right before testing. This includes kelp tablets and certain thyroid support blends. Selenium is often mentioned online, but unsupervised supplementation can be risky. Discuss diet and supplements with your clinician rather than tinkering on your own. What if your results come back borderline? Terms like subclinical hypothyroidism, abnormal TSH, normal free T4 live in a gray zone where symptoms, antibody status, age, cardiovascular risk, pregnancy plans, and repeat testing over time guide decisions. An endocrine society perspective emphasizes caution. Not everyone with a borderline number needs medication immediately. Some benefit from watchful waiting with periodic rechecks. Others, especially those planning pregnancy, with positive antibodies or with significant symptoms, may warrant earlier intervention. Work with your clinician to personalize the plan, and remember that treatment, when indicated, is usually straightforward and well-studied. Here's a fast action plan you can start today. First, complete that 14-day log and bring it to your appointment. Patterns speak louder than single complaints. Second, write a concise one-page health summary. Current medications and supplements with doses, prior thyroid tests with dates if you have them, family history, and any autoimmune diagnoses. Third, discuss a testing approach that starts with TSH and adds free T4 if needed, plus antibody testing when appropriate, while also checking likely lookalikes like iron deficiency. If hyperthyroid symptoms dominate, ask about tests tailored to that pattern and whether an ECG is sensible if palpitations are frequent. Fourth, choose one daily habit to adjust now while you wait for labs. Consistent sleep timing, a short walk after meals to support energy and digestion, gentle strength training twice a week, or dialing back ultra-processed foods and excess sodium to reduce water retention. Small sustainable habits compound, especially when metabolism is idling low. Let's lock this in with a quick recap you can remember under pressure. fatigue out of proportion to effort, feeling colder than others with drier, itchier skin, modest weight creep or a plateau that laughs at your old playbook, diffuse hair thinning and, in some, fading eyebrow tails, brain fog or mood shifts that don't line up with your life story, bowel rhythm changes towards slower or faster, and for many, cycle irregularity, or if you don't menstruate, a resting heart rate drift and new palpitations. None of these proves a thyroid problem on its own, but when they cluster and persist, testing turns guesswork into a plan. Educational materials from the American Thyroid Association, the National Institute of Diabetes and Digestive and Kidney Diseases, and other reputable groups converge on a simple message. Symptoms can be subtle, testing is accessible, and treatment, when needed, has clear goals and follow-up. If this helped, drop the word thyroid in the comments, and I'll share a printable 2-week checklist for symptoms and lab prep. Share this with someone 30+ who keeps saying, "I'm just tired," because noticing a pattern early can be the difference between dragging through the week and feeling like yourself again. Subscribe if you want the next videos in this series. How to prep for thyroid blood tests the right way, and the earliest sleep and heart rate changes that often appear when thyroid levels drift. Information guides smart decisions. It doesn't replace care. Don't start or stop medication on your own. Partner with your clinician for testing and treatment that fit your history, your goals, and your life.